it's worth looking into. It's also a journey, so to speak. So if you think that you're going to go to one class and not need any more, that I'd ask them to just rethink that, just to know that ultrasound is a user-dependent skill.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Candice Dery from Aesthetic Imaging. She is a diagnostic medical sonographer who specializes in facial ultrasound. She is the first ever to create a facial ultrasound training program from the perspective and clinical background of a medical sonographer. Candice's training is unique and recognized nationally. The applications of ultrasound within aesthetic medicine improves both patient and provider safety and accuracy. So Candice, welcome. Glad to have you on the show.
Thank you so much, Daniel, for having me. I'm excited to be here.
Yeah, so let's just dive right into it. I'm curious, how did you first get interested in the medical industry?
Well, medical aesthetics or medical industry?
Let's do both. Let's make it interesting.
Yes, absolutely. So I already knew from a young age that I wanted to be in healthcare of some sort. So it was really easy for me to just dive right in. It was something that was just innate within me. And so I hopped right into all my prerequisites in healthcare and loved everything, the A&P classes, the Cadaver courses, all of it, anatomy, which eventually led me into diagnostic imaging, so advanced radiologic sciences. And from there, I chose to eventually major in diagnostic medical sonography. So again, from a young age, I always knew I'd be into medicine and healthcare. It fills my soul to be able to help those who need help and to be able to be qualified to do that. So it was something I always kind of knew.
Okay, got it. So that's the medical side. Then how'd you get into the aesthetic side then?
So that's much more recent, actually. So I have been in diagnostic medical sonography for 12 years. Love it, and have been at the hospital and clinic phase of ultrasound. I have a dear, sweet friend, Yvonne Delos, who I know that you know as well, Daniel. She called me up one day and said, "Hey, I'm going to be in your area. I'm going to an ultrasound course," and that totally piqued my interest. And I had to give her a hard time saying, you know that as one of your best friends, I am a medical sonographer. Why are you going to an ultrasound course? Tell me more. And so she proceeded to. She said, "We're utilizing ultrasound within aesthetic medicine now." And instantly I thought that she was referring to ultherapy. And so I was like, "Oh yeah, I've heard of that." And she said, "Actually, you need to look into it. It's more than that." So she sent me a little bit of information, and that's when I began my deep dive into why providers were starting to incorporate, or at least try to learn, ultrasound and have it within their practice and wanting it as one of their skill sets. And it immediately got me interested once they said it's about patient care, provider safety, all of that. So I then took the deep dive into reading all the articles I absolutely could about it, with some amazing encouragement and support from Yvonne. I am super grateful for her to be able to have brought this to my attention and support me and be one of my number one cheerleaders to be able to take this route, learn aesthetic medicine and the ins and outs and how to apply ultrasound to it. So that happened within the last 2 years, and I haven't looked back. It's been an amazing journey to be able to take my craft, something that I've specialized in for years, and transition that into aesthetic medicine. It's super fulfilling.
Got it. Thanks for sharing. Now, could you describe a little bit more of exactly what type of service that you provide?
Oh, thank you. Yes. So as a medical sonographer, I chose to create a training program to be able to assist providers in learning the most efficient and effective ways to apply ultrasound. So my top service right now is when medical clinics, aesthetic clinics, or individual providers hire me to come to their clinic. I fly to them and we do an in-house private training. And what's unique about these trainings is they are either one-on-one or 2-on-1. We do not usually go above 4 in our trainings, 4 providers in our trainings. And we do that primarily because we really want the attention and focus to be on these providers who are really wanting to learn as much as they possibly can from me. And in that intimate setting, they gain so much more knowledge about what they already know, what they may know, and what they may need to work on. We can critique their skill set and help them improve much faster when we do this approach. So it's by far my most popular service right now. Others fly to me here in Portland, Oregon, where I do private trainings here or small group sessions here as well. Secondly, providers who encounter complications will call me or FaceTime me, ask me what I'm seeing on their images, how I can help them scan better. So these are ideally providers who already have access to their own ultrasound, or someone in their area has an ultrasound. All of my providers who I've trained know that they can call me anytime with a complication. And it's usually easier to assist them because I know how they've been taught. I know that we speak the same language. I can tell them to manipulate their device or their transducer in a way that will help me see better. And then others who don't have a device, they can actually call me and hire me to fly out to them or travel to them with my own device, my ultrasound device, to be able to scan this complication for them and help them clear it, which is super helpful. They are always happy to see somebody come in to help save the day in that regards. Yeah.
Okay.
The third thing that I do offer, which is kind of, it wasn't planned, but it's been one of my most exciting aspects, and I'm learning a lot from it as well, is a lot of times I am hired to be on faculty for a lot of cadaver and anatomy courses right now, which it's an incredible experience. I love educating on faculty in that setting as well to help providers understand the facial anatomy better. So it's not always about teaching how to utilize ultrasound. It's teaching these providers truly from going from a facial anatomy in a cadaver and transitioning that to facial anatomy, applying it to our very much alive patients with using ultrasound. So helping them understand the anatomy and how everyone's anatomy is different, anatomical variations, all of that can be seen and truly appreciated in real time on ultrasound. So that's been a really big and impactful opportunity on my end that I'm super grateful for and to be a part of.
Got it. Now, I'm curious, how do you differentiate your services from maybe others, your other competitors? And actually, to that point, you came up with like the first training program in this specifically. So I'm wondering, are there even any other competitors out there that's doing what you're doing?
That's a great question, actually. Since I have started, I know of 2 other sonographers that are amazing colleagues of mine that are starting to train as well in their own style. We have never trained together yet. More to come on that. Super exciting things in the future there. But I love supporting my fellow sonographers in their pursuits. So we do have a couple out there that are starting to do more one-on-one private trainings because, again, they're coming from a sonographer standpoint. They understand how applying what we know and what it takes to really get that education to sink in and to keep that skill set always growing and not just like a one and done type of education. So to answer your question, are there any other programs out there? Of course, there's some really amazing group programs out there right now in aesthetics that are teaching facial ultrasound. And a lot of them are more large groups. And I do think that they still come with their benefits and giving everyone like a taste of how to utilize ultrasound. But what we are finding, and I think all of the educators out there would agree with me, that utilizing and learning how to incorporate ultrasound successfully into your aesthetic practice is going to take you more than just one larger group event or educational course, because one instructor can't possibly connect and evaluate someone's ultrasound skills with that many people in the room. Does that make sense?
Yeah. Mm-hmm.
Yeah. So I feel like that's really what differentiates my training from the larger group trainings. Mm-hmm. And then on top of that, I am one of the very few that fly into your clinic, come to you so you can stay in your setting. It keeps you in your office, keeps them from traveling as much, and I come to them. A lot a lot of these educators and providers are already traveling a lot to all their aesthetic conferences and the other trainings that they do as KOLs for other companies. And so it is valuable for them to say, hey, I'm done traveling and I want you to come to me for this. And it's working out really well.
Okay, perfect. Now, how do you approach educating providers about the services you offer and the benefits of it?
I have a website that talks about all of my services and the benefits of that. I stay on Instagram as well. Obviously, my company is still really small or young. We're newer in aesthetics, and so as our company grows, we're learning a lot about how to reach our providers and allow them to know exactly who we are and that we're here long term, right? Yeah. So a lot of my business truly comes from word of mouth, referrals. That has been the number one success for me. Aside, you look at all the statistics from website and Instagram, and 90% of my business is word of mouth, which is incredible. And I'm truly grateful. That speaks to our training, that speaks to my qualifications, and really what's happening after I leave their clinic. My community is really tight, and I very often get personal text messages or DMs from my providers. They're willing to ask questions. They know they can come to me for things, and I think that's also something that sets me apart, is I want to see them grow, and I'm willing to take the time even after the training to help advance their education. They don't always have to rebook with me to get, some tidbits of education. And I think that providers really appreciate that.
Okay. Now, when it comes to talking about the providers, could you describe a little bit more about exactly what you do, how that enhances what the providers are doing or their services that they're offering?
Yes. So providers, when they hire me, they have already acknowledged that ultrasound is going to be valuable for their practice to some degree, in terms of locating new and old filler material, locating or appreciating the very unique anatomy of each individual patient in real time as they're sitting in their chair, so they can provide the correct treatment recommendation or see what other kinds of treatments they've possibly had that the patient's history may not be lining up. A lot of patients might forget that they had filler placed in the tear trough 7 years ago, and so they forget to mention it. And to an aesthetic provider, it's really important to know what's already there. They can appreciate that. So a lot of providers just want to be able to truly see beneath the skin before they go in there and place more product or recommend a treatment. And so most of their goals are to, number one, prevent adverse events or complications, of course, but number two, also to be more on the preventative side of things. So when I go in there, I teach them how to differentiate the tissues in the face, all the different layers, so they know what anatomy looks like on ultrasound. And then we dive into looking at the vascularity, what the filler products look like. So when I leave, they are able to assess each patient as uniquely as they are sitting in their chair each time. And I think that just brings more confidence and peace of mind to our providers, which I love. I'll get a text on the flight home saying, "Oh my gosh, Candice, you were right. Just this one thing that you taught me has been so beneficial already. I went to inject in the temples and saw the superficial temporal artery exactly where I wanted to place this filler, and so I canceled the treatment. Thank you so much. I applied what we learned, and it's already paying off." And that means everything.
That's amazing. Now, I'm sure that, so I guess if it to summarize it, basically comes down to what you do and help these providers with is increasing the patient safety and also getting better results for the patient as well, right?
Yes, correct. Better treatment outcomes, saving the patient from maybe potentially getting a treatment that is going to be ineffective for them. Seeing what happens, watching how the filler behaves in soft tissue real time is so invaluable to see. Is the product you just injected, is it staying right where you wanted it to go, or is it somewhere else? And does that surprise you? Maybe even changing injection techniques to become a little bit more proficient at a specific treatment even.
Okay, got it. Now, I'm curious, you must have a lot of misconceptions about what providers think that your services do, or maybe that it doesn't do. So do you mind sharing just some common misconceptions that providers have about the service and the training that you provide?
Yeah, so the most recent one that I was a little surprised about, but when I look back, just need to be more clear about, is that I am not an injector. So making sure that my providers know that I am not an injector, that I am truly coming from a diagnostic medical sonographer background. And when I say that, the misconception is that a medical sonographer is like, the background is going to like 6 to 9 months of schooling, which is incredibly inaccurate. It's an advanced bachelor's degree. So we're going to school between 4 and 5 years, and that includes a 1-year externship where you're in the hospital that entire year scanning hundreds of patients, hundreds of hours before they even consider you being proficient or competent in ultrasound examination. So it isn't, a quick little course that you can just take. There's a lot of emphasis on our background. And I've had provider feedback say, Candice, you need to be leading with that this is your craft and your profession, and it didn't just take you, half a year to complete it. So those are the biggest misconceptions. I can tell you exactly what you're seeing on ultrasound, but the treatment you're providing is truly your treatment, your aesthetic treatment with your patient.
Got it. Now, when it comes to the best fit for your program, who would you say is the best fit as far as person or personality or size or anything along those lines? Who's the best fit for your training program?
Any aesthetic provider who is ready to utilize ultrasound, who are excited about it and ready to be all in. If you're just wanting to kind of dip your toe in and kind of see, I'd prefer, maybe you go to like a bigger program that maybe is less intensive and probably a little bit more budget friendly versus a one-on-one training. But those providers who see the value, are already utilizing ultrasound, or know that they really want to hop in and get started aggressively, those are the providers that seek me out and are like, get me on your books, get me on your waiting list. I'm ready for this. I always tell my providers, hang in there. This training will be like drinking from a fire hose. You'll love it. Don't panic. I'm here for you even afterwards. So if there's anything you don't get, you can always, reach out to me and we can go over some concepts. So like a whole blanket statement would be, yes, everyone can take my program and I will cater it to your needs. But the ones that really find a lot of success with it are the ones who are already passionate and see the value of ultrasound. I'm not here to talk any provider into seeing the value of ultrasound. I see the value of it. I know that there is amazing value when it comes, like we've talked about, patient and provider safety and accuracy. And I'm here to support those providers who are ready to take that step. But also, that's why I utilize my own ultrasound and provide services for those providers who aren't quite ready. And they're like, I'm not ready to take the training yet. I'm not ready to make that kind of investment in a device, but I see the value. And that's where I offer my personal professional services to come and scan for them as needed.
Got it. Okay. Thank you for sharing that.
Yeah.
Now, I'm very curious as far as, because when you think about medicine, I think a lot of people think about, it's a step-by-step process. It's very scientific. There's maybe a little bit of room for flexibility, but you pretty much have to follow this step-by-step path. But I'm curious, in your opinion, what role do you think creativity plays in your approach for how you do your services and how you teach your students?
I purposely did not go to any training before, any type of facial ultrasound training for aesthetics before I created my own program for that very reason. I wanted to keep the creative juices flowing. I wanted to have my blinders on, so I was completely unbiased, so I could truly create what I wanted to and allow that to grow and flourish with my own creativity and my own background. Because I do feel like it's so easy for us to, we can't unsee something after we've seen it, and how do we not, try to use that and fit it into some cookie cutter mold. So I leave a lot of space for creativity in my training because everyone's different. Everyone's learning style is different in their approach. I reserve the right to change up a part of my training, and I want that in every single aspect because no two people will learn the same way, and I want them to walk away from training with me saying that was so valuable, and I saw how she shifted what she was doing in order to cater to my needs. And so I feel like that's a beautiful part of more intimate one-on-one trainings, is to be able to keep that creativity. Because you're right, Daniel, I feel like there is that step-by-step process, that there are steps that we cannot skip in order to understand things, especially when it comes to medicine, physics, all of those things. But to be able to add your own little vibe or your own creativity to it is going to set you apart. It's going to allow you to reach your audience in so many different ways. And so I think it is important to be able to keep that open.
Got it. Great answer.
Yeah.
Now, you kind of told a story before about one of the students that you went to go see, gave them the training, and then they had a great experience with their patient. But is there another story that you can share that maybe there was a challenging case that either the practitioner had or maybe that they had with their patient, that after you came and you gave the training, and either the practitioner or their patient was able to get a really successful outcome? That was maybe a challenging case.
Yeah, absolutely. I partner with a lot of either like aesthetic institutes, things like that, and they all have me on their emergency contact list, right? They have their emergency kit, their emergency contact list, and they'll call me if something during a course goes in a wrong direction, or they're just thinking that there's something that's a little questionable. And so, yes, so one day I received a call saying, "Hey, Candice, we think we have a VO. Yes, we've taken your training, but we'd feel much more comfortable if you would just come in and scan for us." So again, I got the green light to go in, went in, and yes, everyone was a little nervous. They were all hanging out. And they asked me to assess this patient, and I will make sure that I'm pretty vague, just because I want to protect the patient's privacy. But they were all excited for me to be there, set up my equipment, and the room got quiet, obviously. And as soon as I put my transducer down, that's when everyone wants to know, like, is it okay? And I'm like, give me a few minutes, let me scan the area. It's not instantaneous, but ultimately I was able to find a few silent areas, have the injector inject the hyaluronidase in those areas, and restored perfusion of blood flow was obviously seen under color Doppler on my ultrasound device. The patient obviously felt so much better. You could tell the energy in the room changed. Providers were thanking me, all the things. And so essentially, even those providers who may have taken a basic training might just need that extra support for you to either come in, or they're just feeling too tense to really assess a newer skill. And so to have me come in and have them inject minimal amounts of hyaluronidase, resolve it within 30 minutes of me being there, and they followed up with the patient the next day, and everything looked wonderful. So the whole staff was happy. I was happy. I usually stay on call as well for that patient through the next day to just make sure that they don't need me to come back in. But ultimately, we expedited the process of clearing any type of complication or vascular occlusion in minimal amount of time with minimal amount of product, and everyone was happy at the end of the day. So it's pretty incredible.
That's a great story.
Yeah.
Now, Candice, I'm curious, where do you think the future of aesthetics is going?
Oh my goodness, up. No, I think it's amazing. Daniel, I know it's projected to grow, and I don't have all the numbers here, but obviously some substantial growth is going to be happening in our future. And I do feel like the providers who are taking the time and making the investment to understand the applications of ultrasound and apply it within their practice are not going to regret doing that as we grow. I'm already having personal friends, colleagues, anybody who actually knows what I do. They all circle back to one common question: do you have a list of providers in my local area who utilize ultrasound within their aesthetic practice? That's like the question I always get, and I always connect them with if I know somebody in that area who does that, or if I've trained that person, I will send business their way, because patients are really looking for that higher standard, and they want to be safe once they're fully educated about the risks that are involved. They want somebody who has ultrasound or has access to somebody like myself to help.
Got it. Okay, perfect. Now, Candice, I have one last question for you, but before I ask it, I want to point people to your website at www.aestheticimagingservices.com. Now, the last question is, what would you say is the most important piece of advice you can give to somebody who, or a provider, who is not sure or not aware that they could use services like yours?
I would say to all of them that it's worth looking into. It's also a journey, so to speak. So if you think that you're going to go to one class and not need any more, that I'd ask them to just rethink that, just to know that ultrasound is a user-dependent skill. And if any of them have any questions or concerns about it, that they're more than welcome to reach out to me, and I'd be happy to steer them in the right direction, whether it's devices, training options, or any type of consultation if they already have a device.
Got it. Perfect. Well, there you have it. Candice sharing her expertise. Now, Candice, where can people contact you and your business?
So my website, like you just said, absolutely. My personal phone number is also on my website. My Instagram is aesthetic_imaging. You can find us there. And then, my email is also on my website. So any means of communication. We are located here in Portland, Oregon, but we travel all throughout the states as well.
Perfect. Well, great. Thanks for being on the show and sharing your message.
Thank you, Daniel. I appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.